Hi, my name is Miley Hewitt. We'll be performing a BE trigger simulation today. Before we get started, I just want to go over some of the supplies that you'll be using that you want to make sure you get out and that are handy throughout the exam. So first off, we need some towels, just in case there's a big or small spill. We have a variety of sizes. We are going to use one of the small towels to be putting our lubricant onto. That way when we go to tip, we can easily grab the tip, swipe the jelly, and insert with ease. We want to have some tape handy. The tape that we're going to use to hold the tip in place. That way when we're doing our overheads or during the floral portion of the exam, that the tip stays into place. In addition to the tape, we'll be using an air inflator that'll inflate the cuff, the little balloon, that's around the tip. We also need an air infuser. This air infuser we'll be using if we do a double contrast study. It'll be used to insert the negative contrast. In addition to that, we need our contrast. So we'll either be using barium or we'll use something like Sisoconray if there's any suspected perforation. Today we have put thin barium into our barium bag. We also need a barium bag with a barium enema tip. We will need a hemostat, which will be used to clamp off the barium to make sure we're not leaking barium all over the place and we can control the flow. There's also going to be a second notch here to control the flow, and if you'd like, sometimes people like to use more than the two options or use two hemostats instead of this generic one that comes on the tube. We also need gloves for sure. Some radiologists like to use a compression paddle, so just make sure you have that on hand. And also a lead glove. While doing pediatric patients, the lead glove comes in handy for the radiologist for positioning purposes. Last but not least, we want to make sure that we put a chuck on the bed, just easier for cleanup if we have a spill. All right, let's go ahead and get started. Hello, Omar.
Hello.
Hi, my name is Miley from X-ray. We're going to be doing a barium enema exam. Have you had a barium enema before? No, first time? Okay, perfect.
Yes.
Can you tell me what kind of symptoms you've been having?
Bellyache
Okay.
and lots of pain
Okay.
over there.
Okay.
Yeah. And then the doctor said
Is that you?
I need to see you.
Oh, okay. Perfect. Sounds like good reasons to be getting this exam. There might be a lot of pressure when we put the barium in, but just let us know if you feel too uncomfortable, then we can have the radiologist stop, okay? Is there any chance that you could be pregnant?
No.
No? Okay. Perfect. Okay. I'm gonna go ahead and we'll get started, okay?
Okay.
Alright, we have just completed the scalp image that we will show to the radiologist to make sure that everything is cleaned out. We're going to go ahead and put our patient into the Sims position so we can go ahead and tip. I'm going to remove this shield for now. I'm going to have you roll up into your side so you're facing this wall. That way we're going to have your right knee a little over your left. Perfect. Alright, Omar, so we are going to insert the tip now. We have our barium enema bag at 24 inches, no more than 24 inches. We're going to go ahead and insert the tip 1.5 anteriorly and 2 inches superiorly, no more than 4 inches in total. Alright, Omar, I'm going to just move this to the side. I need you to just relax for me. Try not to push against the tip. And if you're hurting, means just let me know, okay? So go ahead. Alright. So we're going to inflate the insufflator cuff with one pump, no more than 90 milliliters. And we are going to tape the tip in place with a lot of tape. Make sure it doesn't move. So we're now going to go ahead and call the radiologist so he can go ahead and do the fluoral part of this exam. All right. Everything okay?
Yeah.
So the radiologist has completed the fluoral portion of the BE. We're going to go ahead and take our overhead images. We'll be performing 7 images. So first we will drop our enema bag onto the table. We will set up for our lateral, right lateral DQ position. Maybe scoot as far back to that board as you can. Put your back touching that. Perfect. I'm going to put my left marker here on the board to indicate the patient's left side. I have my console set at 125 at 20 mass. So I'm just going to feel for your hip bone. Perfect. Alright, so for our right lateral DQ, we're going to shield the boobs. Right there. Okay. Alright, so we set up for our right lateral DQ. We are centered at the mid-sagittal plane and the iliac crest. We have our left marker on the board. We have slight light above the board just to make sure that we have all of the anatomy. We have some light down here, so we're good to go. All right, yeah. Go ahead and hold your breath. X-ray. All right, next we are going to do our lateral rectum. For our EQ, we use the grid, just for the record. So we're going to go ahead and put our plate into the cookie. We are going to unwind this. We're going to detent our tube to our table. Shield our patients. I'm going to just move you this way. So we're going to center at the as-is and the mid-coronal plane. And we're going to just hold it in. We're going to align our bucky. We're going to make sure we have our right marker down on the table. Okay. We are going to use 120 mass at about 60, 120 kV at about 60 mass. Go ahead and hold your breath. All right. X-ray. All right. So next we're going to do our RAO position, the oblique position. We're going to have our patient, all right, completely onto their stomach. into 35 to 40 degrees. Can I just have you put this arm behind you? There we go. Perfect. Alright, so we're going to center at the iliac crest. At mid-sagittal plane, and we're going to use a 14 by 17. We're going to go 2 inches to the elevated side. Okay. So we're at the iliac crest and 2 inches towards the lateral side of the elevated side. We're going to again use 125 kV at about 30 mass. Before I do shoot my image, I'm going to shoot with my patient. All right. Go ahead and hold your breath. X-ray. All right. So now we'll go ahead and do our PA position. So we're going to have our patient lie completely flat on their stomach. So we'll still be centering at the iliac crest and mid-sagittal plane. Alright, so now we'll go ahead and do our PA position. So we're going to have our patient lie completely flat on their stomach. So we'll still be centering at the iliac crest and mid-sagittal plane. Alright. We're going to be using 125 at around 25 mass. Go ahead and hold your breath. X-ray. Alright, we're going to go ahead and do our PA axial view. We're going to start by putting an angle about 30 to 40 degrees contact towards the feet. We're going to align. We're going to make sure we're aligned with our bookie. We just need 10 by 12. And for this, we're going to be at the mid-sagittal plane and exit at the axis. That's good. So go ahead and hold your breath. X-ray. Alright, so we have completed our PA axial, and now we're going to move on to our LAO position. We're going to have our patient go up to their left side. So I'm going to have you bend this knee and just like that. It's good. So I'm going to put the shield up here. And they're going to going to recenter at the iliac crest and about 2 inches to the lateral side of the elevated side. 2 inches lateral of the elevated side. Alright, we're going to open it up to a 14 by 17. We're going to make sure that we have our bucky aligned. Perfect. And we're going to have our left marker to the left side. Alright. So we're going to shoot that image at about 125 at about 20 mass. 120 kV at about 20 mass. Go ahead and hold your breath. X-ray. Go ahead and relax and breathe. Alright, so now we're going to go ahead and do our left lateral decubitus. We're going to have our patient roll up onto their left side. You can go ahead and bend your knees. We're going to have you bring both of your arms above your head like you're praying. I'm going to put your shield on you. Up. Okay, I'm going to move on.
I'm gonna shoot out.
Here you go, man. Alright. Let's go ahead and put our plate with our grid. I'm gonna have you scoot as close to the board as you can. A little bit more. Alright. We'll go ahead and put our right marker on the board. Alright, so we're going to Alright, so we're going to use 120 kV with about 20 mass. So we're at the iliac crest and the mid-sacral plane, shooting at about 40 inches. Perfect. Go ahead and hold your breath. X-ray. So we have completed the overhead images that are required by the radiologist. We are going to go ahead and have our patient, we're going to drop the bag completely, drain the barium, and have our patient use the restroom, and we will take a post-evac picture. We are going to deflate. Before they go to use the restroom, we're going to make sure we deflate the balloon, that we remove the tip, and that completes our barium enema.
Now that we have completed our exam, we can check to make sure our images are of acceptable quality and include the necessary anatomy. This first image is our AP scalp projection taken at the start of our exam. This projection is like a typical KUB and needs to include from the pubic symphysis to the diaphragm. The colon is unable to be seen with this image without the introduction of contrast, but the importance of this image is to make sure our patient has successfully prepped for this exam, leaving the colon free of fecal matter. The next image is our right lateral decubitus projection. On this image, we want to see from the left colic flexure to the rectum. Decubitus projections are characterized by the fluid levels that appear from having the patient lay on their side. The side of interest on the decubitus projection are the areas filled with air, as the presence of pathology would be seen rather obstructed by barium. The right lateral decubitus projection looks at the medial side of the ascending colon and the lateral side of the descending colon. This next image is our right lateral rectum projection. This image is looking specifically at the rectum and distal sigmoid area. Here we have our PA oblique projection with the patient in a RAO position. In this image, we want to see the entire colon, but our area of interest is the open right colic flexure, as well as the ascending colon and sigmoid colon. The RAO position helps the right colic flexure open and decreases superimposition. This next image is our PA projection and shows our entire colon from the left colic flexure to the rectum. This is our PA axial projection and looks specifically at the rectal sigmoid area of the colon. This image shows less superimposition of this area due to the 30 to 40 degree caudate angle that we put on the tube. This is another PA oblique projection, but now the patient will be in a LAO position. We still want to see the entire colon, but we are looking specifically at the left colic flexure and descending colon. The LAO position helps open up the left colic flexure, demonstrating it with less superimposition. This is our left lateral decubitus projection. On this image, you want to see from the entire colon. The side of interest on a decubitus, left lateral decubitus projection are the areas filled with air. This projection demonstrates the medial side of the descending colon and the lateral side of the ascending colon. This is our final image for the exam and is our post-evacuation image. This image is taken at the end of the exam once overheads are complete and the patient has gone to the restroom. This image shows the same area as the scout image, but we are able to see some residual barium. This image helps to show that the barium is leaving the colon properly. Polyps can also be seen during a barium enema exam. A polyp is a growth or mass protruding from a mucous membrane. The barium helps enhance the polyp by making it easier to be seen, coating the outer surface. One type of pathology that can be seen during this exam is diverticulum. These are pouches created by the herniation of the mucous membranes through the muscular coat. The presence of diverticulum can be clearly seen on a radiograph as thick light projections on the outside of the colon.
So I want to make my videos because I end up having to edit. First, on your back. Yeah. Get back up. Has completed his portion of the floral of the BE. So we're gonna go ahead and I'm gonna get this phone call. Yes. Which is on the fucking board. In your mom.